So I'm going to come in. Hello, my name's Clarissa. I'm going to be your nurse today. I'm just here to do a newborn assessment. I'm going to provide for privacy. I'm going to wash my hands, don my gloves, and check the baby's wristband. Ask the mom, can you just verify the name and date of birth? Okay, and then I will check the moms to verify they match, so they're good. All right, so when I start the assessment, I want to go ahead and get the anything I have to auscultate out of the way because the baby will start crying. So I'm going to do the apical pulse sounds first, the heart sounds. As I'm counting this, I'm going to listen for a full minute. We want it to be 110 to 160. I'm also going to be listening for any murmurs or abnormalities. It's 135, so that's good. After this, I'm going to go ahead and listen to the lung sounds, to the breath sounds. I'm going to listen to newborn. It's 5. So we're going to go right, left, and right again. Same 5 spots in the back. Right to left, and then right again. Okay. Right now, since he's still not crying, I'm going to go ahead and do the bowel sounds in all 4 quadrants. Making sure they're active and present. And they're good. All right. So I'm going to go ahead and check the skin turgor around the clavicle. It's good. While I'm up here, I'm going to go ahead and check the temperature. Placing it parallel along the body. We want this to be from 97.5 to 99.5. It is 98, so he's good. Next, I'm gonna go ahead and assess, palpate his abdomen, make sure that the bladder and nothing is distended. It's non-tender, so he's good there. I'm gonna go ahead and flip him over, just assess his spine. Making sure it's in alignment, making sure there's no dimple or abnormal tuft of hair at the sacrum coccyx area. And there's not. We're going to check for any lesions, birthmarks, or bruises back here. He's good. Rolling back over. I'm going to go up and start at the head. I'm going to do the scalp first. So going to palpate suture lines, make sure they're fused together. They are. Going to palpate the anterior and posterior fontanelles, just make sure that they're soft and flat, and they are. We don't want those to be sunken in or raised. Now we're going to make sure his hair is evenly distributed and there's no birthmarks, lesions, or bruises on his head. Going on down to the eyes, we're going to make sure the outer canthus are equal to and level with the pinnas of the ears. They are. We're going to check his sclera, make sure it's good and white. It is. We're going to make sure his conjunctiva is pink. They are. Moving on down to the nose. We want to make sure it's midline, no deviated septums. We want to make sure that there is no respiratory distress. His abdomen and chest is moving equally and evenly, and there's no nasal flaring, and there's no retractions. Okay, so anyways, back to the nose. His nares are patent. We're going to move on down to the mouth. Make sure his lips and mucous membranes are soft, moist, pink. They are intact. Okay, now we're going to go on down to his chest again. We're going to make sure there's no lesions, no bruises. It's all good. Go on down to his, we'll stay up here at his arms. Check his brachial pulses, check his capillary refills. They're less than 2 seconds, so they're good. You're going down to check his pedal pulses and his femoral pulses. All of his pulses are strong and equal bilaterally. We will go ahead and trying to think if there's anything else before I need to change my gloves. I don't think think there is. Okay, so I'm gonna go ahead and change my gloves and start on his reflexes. The sucking one is the one I'll start with because you have to have a fresh, clean gloved hand. So I'm going to insert my finger like this, and we'll want him to do a sucking motion. So he is, it's good. And as I'm removing my finger, I'm going to rub on the roof of his mouth just to make sure that his palate is fused, there's no cleft, and everything feels normal in there. I'm going to come back out and I'll just do the rooting one next. I'm just going to take my finger on the side of his mouth and just rub it up his cheek. See if he'll follow it, and he does. He turns his head and follows it like he's rooting, so that's good for breastfeeding. Go ahead and do his palmar reflexes. I'm going to place my finger, and he is going to close his little fingers over my finger. He does. We'll go on down to his feet, and I'll put my finger, just lay it along the toe line on the bottom of his foot, and he will close his toes over it. He does, so that's good. That's his plantar reflex. I'll go ahead and do the Babinski. So I'm going to take my finger, and starting at the heel, I'm just going to go like this, and hopefully he'll fan his toes out. He does. He does that on both feet, so he's good. Okay, we'll go ahead and do the tonic. I'm going to turn his head to this side, and so he is going to put this arm and this leg out, and he's going to take these into him. So whatever way the head turns, that arm and leg is going to go out, and the opposite is they're going to bring into him like fencing. We can do the stepping one next. So I'm going to hold him up, and he's going to, I'll place his feet on the bed, and he's going to act like he's stepping or bending his knees, so that is good. And then we'll do the Morrow. So I'm going to hold him up a little bit off the bed and kind of startle him. And he should take his arms out and then bring them back into him really fast. So he did that good. Next, I will change my gloves again, and we'll do his genitalia area. So I changed my gloves, and I'm going to go ahead and just assess his umbilicus. So we're checking for any drainage, any blood, any kind of swelling or redness that shouldn't be there. It looks good. So removing his diaper, we're looking at his, he is circumcised. So we're going to check for any bleeding, any purulent or strange drainage, and just making sure that it's not too swollen. It's going to be a little bit, but nothing abnormal. While we're down here, we're going to check his anus, make sure it's patent, make sure that it is, make sure there's no skin breakdown, make sure there's no strange drainage from that. If this was a female, we would check her labia and make sure that the majora is larger than the minora. He looks good down here, so I'm going to go ahead and re-diaper him. This is going to be when I ask Mom if he's had his first meconium stool. He has, so yes, that's black tarry stool. That's good. Has he had his first urine diaper? Has he had 6 to 8 wet diapers a day? Just let her know that he should have at least 6 to 8 wet or dirty diapers a day. Was his urine bloody? Did it have a certain odor? Was it any strange drainage in there? She says no, so that's good. Once he's re-diapered, I'm going to change my gloves again and redress him, re-swaddle him. I'm going to make sure that Mom's call-out is within reach, and I'm going to document that his cry was really strong during the reflexes, his movements were really good during the reflexes, and that he done the reflexes correctly, like everything happened the way it's supposed to. I'm also going to document all my other findings during the assessment and let Mom know to let me know if she needs anything or has any questions. I'm just going to ask her if she wants me to leave the baby with her or take him with me back to the nursery. And that is it.